Welcome, Kate Cordell with Opeeka, to our Fireside Chat, and welcome to Texas. This is the first time you sponsored, and we're so happy to have you, and thank you for your support. Tell us a little bit about you and your background in Opeeka.
Thanks so much for having us. So my background is that for the last 10 years or so, I've been consulting in social welfare and mental health services, trying to unify information across the different systems in the system of care and beyond. And I've done a number of technology projects that really was trying to bring the information together to help understand a whole person and a whole family, so we could better serve in the context of that person and family. My master's is in public health and biostatistics, so I bring that lens as well. And my PhD is in social welfare from UC Berkeley, so I bring that lens together and try to better understand how we can use information in a more uniform way, rather than have it siloed across all these disciplines where families have to get services in different areas.
I like it. I've had a chance to preview Opeeka and your technology, and I love it that it really seems to be bringing a solution to issues that we have and not the reverse to that. So I have to ask, what's the meaning of Opeeka?
Well, Opeeka actually means resilience in Telugu, and it means care in Polish. And so we really felt that this embodied kind of our mission and our vision. Our mission is around well-being, bringing well-being for all. And we really want to bring a success-focused lens to care. So what that means is right now, I think in care, a lot of what we look at is the negative. We look at what's the risk level of this person, and what's the likelihood of failure, and what's the recidivation rate. And instead, we really try to bring success focus. So what does it take to lower risk? And people who have succeeded before, even despite being the highest risk level, what did they do to succeed, and how can we rinse and repeat that? So how do we take this negatively focused approach and turn it on its head and find out how to lower risk and achieve success more often? So that's really what Opeeka stands for.
Okay, and that explains then how you're able to take just tons of data and systems and all these things and pull them together into what I heard you call in the demonstration I saw a storyboard. Did I get that right?
It's a story map. No, it's fine. So this concept came up because when you're bringing a lot of information together, it's really hard. Like if someone wanted to read through somebody's story, right? It might take a day to read a book about some of these folks' stories, and you really need to have that context around what their story is to provide care. So what we developed was what's called a story map, and it's a visual representation of someone's story, and it's kind of what a clinician or a social worker would be building in their mind anyway. When they see that child or that youth, they're thinking, they've got this trauma and they have this past history and maybe this happened. They've got this resilience though already that we can build upon, and then they have these areas of needs or symptoms or anxiety, and it's a map that's built out. And every time that youth walks through the door, that social worker sees that map in their head. And the great thing is we build that out in our software so that is represented. And when the social workers see the map, they actually are not overwhelmed. They're like, this is the representation of that person. And it's not just the person, but it's the family as well. It captures the parents' strengths, the caregiver's strengths, the caregiver's needs and areas to improve, and it just maps it out visually. And that has been one of the foundational pieces of what we do, because from that map we can now look at how that story changes over time, and so we can see them develop resilience, address needs, and move through care in a positive way.
So the professionals involved can see the progress of the case and the story as it evolves.
Right.
And for the child or the family at the center, they don't have to keep retelling their story.
That's exactly right. They don't have to retell their story. So sadly, oftentimes the only continuity in care is the child themselves. Often there's a huge turnover in staff, especially if they're in care for years. They're going to have to tell and retell their story. But what we've done since we've created this visual map is have that ability to capture or to view and understand that story in a single glance. So you don't have to read through all the notes or ask that youth or family again, why, what happened to you? And so that kind of helps reduce the traumatization, as well as create continuity of care, because as new caregivers and care workers come into that person's life, they can see that trauma without having to ask about it. They know it's there, and they know it's going to come up in different behaviors or different responses, but they don't have to ask about it.
I'm excited for people in Texas to get to know you. If people want to learn more, how should they reach out?
I'm on LinkedIn, so that's one easy way. Find me on
Kate
LinkedIn,
Cordell.
Kate Cordell on LinkedIn, and also on our website, it's Opeeka, so it's www.opeeka.com.
Great, and you're a supporting member of the Alliance, so you could also call us, anybody at the Alliance, and we'll make sure that they get in contact with you. And you have an amazing team, so thank you so much for being here. We really appreciate it.
Oh, thank you so much for having me.